message to people, millions of people across the country. Why am I here? They want me to tell you why I'm here. As you saw in that open, my wife and I, who wanted to be here, but it physically cannot emotionally deal with these things, wanted to be here, but she is watching right now on television. We're here because we lost our only son, Eric Chase. He was a sophomore at University of Colorado to an opioid, one pill. He took a Xanax tablet that he bought on campus. It happened to be laced with fentanyl. He thought it was real, it wasn't, and he passed that night. So I've made it my mission for the last year to get the message out. Again, thank you to all the people, thank you to the sponsors, and also Sinclair Broadcast, who's doing 14 of these town halls around the country. I want to kick things off with someone I met at WCIV in Charleston. Her name is Nancy Stedman Shipman. Our ABC News 4 Dean Stevens had a minute with her earlier. Watch.
It's rare when Nancy Shipman can take a break. With her 6-month-old napping and her oldest son taken by an overdose 3 years ago, her candle burns at both ends.
After we lost Creighton, which would have been the perfect time to quit and say, well, so much for the hope. But our community and our family and friends were right there to reaffirm what Creighton said that very first day, that you need all the help you can get from your family and friends.
Creighton was a ray of sunshine, the first baby born in Mount Pleasant in 1997.
Caitlyn!
His death led to a family promise, a mission to help others.
What I hear from Creighton often is, keep on going, keep listening. There's a lot of us. It's us, it's we. It's not them or you or just me.
It is now about community. Her involvement with the nonprofit Wake Up Carolina and Creighton's House provides resources and knowledge for those impacted by addiction.
On this path within Wake Up Carolina, I feel like our awareness and prevention are these signs. And we're educating you, as the driver's ed teacher is educating you about what they mean. And then when you pull into your garage, that's your hope and recovery. You pull into your garage, it's safe. You know that it's going to be okay. You can get out of the car. You're fully equipped. You're aware. You're educated. And you have someone right there along with you that can help guide you.
Nancy learned of Creighton's heroin use in a letter he sent from rehab. He would overdose on that same drug weeks later.
Creighton's still around. I miss him. Through his light and love that he lived on this earth, I'm seeing it with so many individuals that their stories of recovery, families that are empowered, that are having conversations they've never had before. So I think it's, to me, it's a true testament of hope.
The Shipmans, a blessing and a testament to grace in the aftermath of loss.
All right, Nancy Stedman Shipman is with us, joins me. Nancy, I hate to ask you this, but you're on this stage, and fortunately we're on the stage for the same reason. Tell us about Cratons Story, your story.
Thank you for having me. I am very appreciative of this platform because I represent not only my story in Creighton, but all families. And Creighton was my son. He was loved. He had an emergency surgery, and he would have lost his life otherwise. And from that, I would later find out 5 years later that it turned on a light that he never forgot. And when he smoked pot, it was laced with heroin, and that light turned back on. And within 7 months later, he had left rehab and overdosed and died. And from that tragedy, our family has shared our story with many because our story is unique because it's our son, but it's not unique because it's a loved one that many people have lost to this disease of substance misuse.
So Nancy, literally millions of people are watching right now. Tell us, were there signs? Give us some idea of what to look for, let parents know what to look for.
I sat in many meetings trying to educate myself. And I sit in front of tons of parents in schools with that same question. If you compare the typical signs and symptoms of adolescents and young adults to the signs of substance misuse among young adults and teenagers, they're very similar. And so when I look back on my own experience, what I would tell parents is the physical signs and the signs of isolation. The child that I knew was no longer. Those were the signs that something was different.
Money, different friends, any of those? Those are common people. Parents will come up to say, I saw a change in pattern with his friends or a change in pattern with her spending habits.
I was a mom, you could say a helicopter mom or a mom that was very involved. I would love to be able to say there were those signs. There weren't. His friends were the same. He was still very active. The things that changed were his humor. He was the most clever person you ever met, full of life, very vivacious. And the things he held dear, his college, his lacrosse, those started dissipating. Within 2 months of use, he quit lacrosse. His grades plummeted. He quit returning text messages to our family group text, which that might not seem like a big deal, but when you're used to seeing each other on a daily basis about your wins and your losses, the things that he valued, those were my red flags. There was no run-ins with police. There was nothing around my house, and I wish there was so that I could look into a parent's face and say, this, and this. Unfortunately, there's not. There wasn't in my case.
So we've been around the country. We've been in so many states and so many cities, and one of the things that we've developed, and this is what we're trying to do, is try and find some answers so that there are fewer and fewer parents like your story or my story. What we found is lifting the stigma of opioids to people, young people, who are fearful of talking to a parent that they'll get in trouble, talking to a teacher that they'll get thrown out of school, talking to a cop that they'll get arrested. Tell me, is there still a stigma, or are we now seeing that this opioid crisis, the only way to solve it is starting by lifting the stigma? Tell me about the stigma part of it.
2.5 years ago when we first experienced this, no one was talking about it. In my experience, there was no conversation. And through our experience, my daughter said, we have to talk about this and share our story. As soon as we shared our story, I cannot tell you how many families came forward with their story, with their spouse, with their parents, with their brothers and sister. And then that's when I realized we're not unique. So with these conversations, sparked more conversations, and the stigma started to lift. And I can tell you in 2.5 years, our police chief in our community is talking about it and doing something about it, being proactive about recovery. It's, very clear that we can't arrest our way out of this. And
I didn't mean to cut you off, but that's consistently, and we're going to have the Mount Pleasant police chief up here in a few minutes, that's consistently that the message is most states have passed a Good Samaritan law that says if you're a kid or you have a friend who's overdosing, or even if you have drugs on you, you bring someone in for help, you're not going to get arrested, you're not going to get in trouble. I want to throw to this package very quickly, guys. Take a look at Tennessee. Now, one of the other issues is you said your son had a surgery that he was using an opioid, I guess,
exactly,
for pain afterwards.
Right.
Look at this town in Tennessee. Look what's going on, and tell me if this isn't a part of the problem as well. Watch.
Pharmacies in Tennessee are ringing in the new year with a new workflow.
It's definitely more of a headache to everybody who's doing stuff responsibly.
Jordan Morrison is a pharmacist at Access Family Pharmacy in Hickson. As of January 1st, he can only fill a narcotic prescription for a 3-day supply.
All the responsible prescribers, all the responsible patients, they all get grouped together because of a handful of some who are abusing it, and so that's frustrating.
Lawmakers passed this new law to cut down on opioid abuse, an epidemic David McNabb sees firsthand.
Whatever you've heard about the opioid epidemic, it's been soft-sold. It's worse than what you hear.
McNabb runs a recovery center in Chattanooga. He says about 80% of the residents' abuse history starts with opioids. Many turn to harder drugs like heroin.
We've got star athletes. We've got some guys and girls who had great promise, great families.
But because they had access to a pill bottle, addiction crept in.
The problem is just that bad.
McNabb and Morrison both say that the new law means everyone is paying the price for abusers. Healthcare professionals will now have several more hoops to jump through. That's to prescribe more than 3 days' worth of these painkillers.
When you've got a national emergency, all of us have to pay the price.
An attempt to correct a problem that's taken thousands of lives.
Actually, hundreds of thousands of lives. That was Cratons Story. That was a star athlete who had a surgery, was prescribed an opioid, turned to heroin after an addiction, and passed. Are you mad at the doctor?
I can only do with what I knew at the time. So at that time, I would have liked to have been educated before we had those opioids. And that's exactly where I feel like education is important. Where do I blame? I blame many, many people.
There's so many prongs to this problem. Doctors overprescribing, pharmaceutical companies incentivizing salespeople to sell more opioids to doctors so that they can turn around and prescribe them. Street drugs being illegal. Give us one last idea as a parent, so if you see your kids starting down a bad path, give them an idea what to do.
Reach out. That's what we did. We realized where we had holes in our community, and we started a nonprofit to where we have all recovery groups for young adults and families. This is a family disease. Not only is the individual suffering, so is the family, and you both have to find recovery.
Yeah, we're going to leave it right there. Also, reach out to priests, reach out to teachers, reach out to cops, reach out to parents, reach out to friends, reach out to neighbors. If you see it, here's what you got to do. Take a look at a number. We're going to flash it on the screen all night. It'll be all over the place. This one is the National Opioid Action Network, 1-800-662-4357. Call it right now. If you know someone who needs help, don't be shy. No one is going to get in trouble. Nancy Stedman Shipman, thank you very much. Coming up, State Representative Tim Scott. We were going to have Tim Scott here, but he had to call, he had to cancel. We have State Representative Russell Fry coming up with the Chief of Police from Mount Pleasant also, Carl Ritchie. Thank you. We'll be right back. Don't go anywhere. Important night.
Narcotics may kill pain, but it's now known they're dangerous and highly addictive.
That's a problem, and as surgeons, we prescribe a vast majority of these medications, so we need to take some responsibility.
Dr. Ken Mitchell is a bariatric surgeon with Roper St. Francis. He performs things like gastric bypass and lap band surgery. Over the last 18 months, he says their practice has reduced the number of narcotic prescriptions written by 97%.
In the year 2017, we prescribed almost 100 prescriptions for narcotics in that calendar year. In this calendar year up through June, I think we've had 131 primary bariatric surgical cases, and we've written 3 prescriptions.
Despite decades of use, he says narcotics are not necessary and actually do more harm than good. Instead, they use a lot of Tylenol and other drugs he says are just as effective.
The whole part of this enhanced recovery protocol is that we give people medication before they hurt.
Part of the protocol, sports drinks like Gatorade.
The saline bag requires an IV. A saline bag also is a risk for infection. You have an IV. This is something your body's used to.
Mitchell says their efforts are just the beginning of a new movement in medicine.
Digging the shoes.
All right, we're back, and as promised, I told you we're going to have State Representative Russell Fry and also Chief of Police Mount Pleasant, Carl Ritchie. Thank you very much. Let me start with you, Representative. Tell us, you have a big initiative at the state level. You're writing a bill to help combat opioid abuse. Tell us about it.
Yeah, thank you for having me, first of all. I chair the opioid task force basically on the state level, and it started off Representative Eric Bedingfield, who also lost a son. He chaired that last year, and he left the legislature. So in the last 2 years, we've had about 18 policy proposals that we've put forward that have become law. We've significantly increased the budget as far as how we deal with this, from education to treatment to really a whole host, kind of a holistic approach to this. But the job's not done. I mean, you see this too, as you study it, that the issue evolves, that there are things that we need to continue to do. And so as we move forward to address this, we're responding to that.
Give us an idea of what are you doing anything different than some other states have been doing as well?
Yeah, I think so. One of the initiatives that we put forward is that if you overdose, that we actually put a recovery coach in the hospital. What we see time and time again is that people go back to that same system over and over again. So if we can transition them not only with medically assisted treatment, but put them with somebody who holds them accountable, the results are staggering. And so that's one thing that South Carolina can be proud of that we're doing that a lot of states aren't. But moving forward, we'd like to expand.
How do you pay for that?
Well, some of it, the Trump administration has been fantastic, actually, in leveraging federal dollars or giving federal dollars to states to address this, because the cost savings is there. If you can educate the public, if you can put people on a recovery, they're not a perpetual burden on the system. And so the savings are there in the long run if we can address this problem right. And that's what South Carolina is doing well, and we're going to continue to do this year.
Chief Ritchie, I mentioned the Good Samaritan Law. Do we have that here in South Carolina?
There is a Good Samaritan Law. It actually covers anyone who responds to an emergency, provides assistance, or makes a call. It protects them from the civil part of it. I think there's more we can do with that, and things I was talking to the lawmaker here earlier that maybe we need to introduce to make it a little more broader to protect those who come forward.
So explain it. So you can still be charged criminally if you're helping someone who's overdosing and you happen to have drugs on?
You certainly could be charged, but I think common sense prevails in most cases now where you do not. We're looking to take care of that person who overdosed.
Hey, Representative, can you work on that part? Can you add that to the bill where if someone is overdosing, it's no questions asked, you get this person help? We can't have kids worried that if they show up at the police station or at a fire station or at a hospital, that they're going to get arrested. We need to add that to that bill. Can we work on that?
That was actually a part of the thing that we did last year, and this year we're doing a lot of stuff to help law enforcement with that. So that's something that we can continue to explore as we deal with this issue.
That should be job number one. We were in Asheville, North Carolina. North Carolina has that law. No questions asked. You're not going to get arrested. You're not going to get in trouble if you're saving someone's life who's overdosing. We want more of that. Chief,
absolutely.
Tell us the difference. You've been around here a long time. Tell us the difference in drug use and abuse in Mount Pleasant in the state of South Carolina over the years.
Well, I don't think we're any different than any other community. We're experiencing the opioid crisis, and it affects everybody. I don't care what walk of life you're from. It's affecting our residents. And as the chief of police, I noticed that our traditional response was we'd respond to the overdose, wait on EMS, stabilize the person overdosed, go back to our job. A month, a week later, we responded back to the same person over and over and over until finally responded to a death. And as a police chief and somebody who's dedicated my life to public safety, I knew we had to do more.
And you started something called First Step?
Actually, we did. Our agency started a program called First Step. And what I had done is I tasked my victim advocates with reaching out to these folks who'd overdosed, getting away from that traditional law enforcement part and getting to more of an assistance role.
Chief, where are these people overdosing?
Oh, everywhere. They're in their homes, hotel rooms. We've had them in cars, parking lots. It's not limited to where it's happening.
What do you see a change? Is it clearly more often because the curve of people overdosing and dying from opioids is still on its way up. Trajectory is higher. But what's different about it? Again, the slope has really increased in the last 5 years or so. What's different over the last few years?
Talking about it more, taking away that stigma, working on.
Is it heroin? Is heroin becoming pills? Well, I'm hearing the evolution of the overdose.
It's a combination. They get started with the opioids, prescription drugs, and they hit the harder drugs. So it's a combination. We're seeing it all that they're overdosing on.
Okay, Representative, tell me about the Trump. The reason why I'm asking you this is I've been at 2 bill signings for $6 billion on the federal level to trickle down into the states and local areas for opioid awareness. Is this some of the funding that you're talking about? Is this the matching that you mentioned?
Absolutely. South Carolina's putting forward their own too. I mean, anything from public awareness like the chief talked about to recovery coaches in hospitals like we just mentioned. Those types of things are proactive.
How much does that cost? How much does a recovery coach cost?
I think I think what we allocated for in this state was about $3 million this year in a pilot program that we hope to take statewide. That's the goal.
How many would that hire?
I think what recovery coaches themselves, you partner up with nonprofits. You partner up with the 301 system in South Carolina, which is our behavioral health folks. And
is this all they do?
That's all they do.
Alcoholics Anonymous tends to have a sponsor. So
right.
If you're an alcoholic, you go through the program, you have a sponsor, and if you need help, you call your sponsor. Those sponsors aren't necessarily paid. Those are just people being good Samaritans.
Right.
But you're talking about something different. You're talking about hiring people to follow recovering addicts down the walk of life.
Yeah, so it's nonprofits like Favor, Faces and Voices of Recovery in Greenville. They do a fantastic job, or it's part of our 301 behavioral health folks. And so what we saw before is the disconnect, is that once they leave the hospital, you've got to wait 2 or 3 weeks to get into a place to begin that life to recovery. And by the time that appointment comes up, you're already back doing the same things again. So this kind of fast tracks you into there. And we've seen tremendous success from that in getting people engaged in that process much sooner.
Chief, Narcan, it's a brand name for a drug that reverses the opioid. Not the addict, the person overdosing is administered 1, 2, or 3 doses of Narcan or so, and they snap out of the overdose. Do you carry it in your squad cars?
We do. Our officers are trained in carry, yes.
Where else? Let me ask you this. What is the one thing that you need that you're not getting on the state level, on the federal level, that would help solve or help us turn the opioid curve downward?
Yeah, I think that helps coming, but more than that, it's got to be done at the local level. It's great what these guys are doing at the state and federal level, but if we're not doing it locally, like you were just talking about our program, our First Step program, is exactly what I'm hearing here. We are doing that with our victim advocates. We're being that mentor at the local level, reaching out to these folks, helping them. We're working with our different recovery coalitions with Wake Up Carolina, and actually they host monthly training where we're actually helping them facilitate providing that Narcan to our citizens. So it's not just in the officers' hands. We have folks that have it in their hands that are saving lives with it. And then once these lives are being saved, we're able to reach out to them and provide them, connect them with the services, because we've made those connections.
We got to go, but I want, Chief, one last question. There's the fentanyl, the thing that's the most deadly opioid on the planet. You have officers who I imagine have made drug busts where they literally have to wear 2 and 3 sets of gloves because just by touching the stuff, you can overdose from it.
Absolutely. We have to be very cautious when we're dealing with it, when we're taking into evidence, and there's a lot of new protocols in place to protect them, protect their lives, and actually prepare them if they were to be overcome, how to save their life as well.
All right, we're going to say thank you to Chief Carl Ritchie, Mount Pleasant Chief of Police, and also State Representative Russell Fry. I want you to take a look at this campus. It's a beautiful campus, Charleston Southern. We're going to say thank you to them for watching over this opioid crisis. When we come back, we're going to talk to a pharmacologist about what's really going on inside an addict and an overdosing person's body and their mind. We'll be right back. Take a look at the sights and sounds of Charleston Southern University.
We were designed.
Good job. Thank you. Oh.
We were designed to be creative. We were meant to seek the truth, to explore the world around us. Challenges, we embrace them. Compromise, never. We are a community dedicated to championing the gospel. We are champions for Christ.
Students go to school to learn their A's, B's, and C's. And starting next year, Horry County high schoolers will have to learn their oxycodons, fentanyls, and methadones, otherwise known as opioids.
An epidemic nationwide, and it's also affecting our community as well. So we want it to be proactive and be able to add that additional education material for our students.
South Carolina requires schools to teach students about drugs. Horry County will just add opioids to the list. Students will learn about how the drugs affect the brain and statistics, and hopefully pass that information along.
And they do incorporate a parental toolkit as part of the program to help not only educate the children, but to be able to pass along that information to parents as well.
And parents wished more school districts would offer these classes.
Somebody's got to teach these kids that shouldn't be doing any of the drugs.
People don't realize how deadly it is, you know? I mean, your life can be gone just like that.
Just like that, before you get all the way from A to Z.
All right, welcome back to the Town Hall, Your Voice, Your Future. Again, opioids, a national crisis. Thank you to Sinclair Broadcast for bringing this message across the country. Thank you to Charleston Southern. Also, thank you to Liberty University. Becky and Jerry Falwell, good friends of mine, part of the sponsors of this as well. I want to talk about the next segment, but first I want to go to ABC News 4, Tessa Spencer, and she had a sit down with the president of this university, President Costin, an interview talking about what they're doing here on this campus. Watch.
Do you know of anyone that's been affected by the opioid crisis?
I learned, as it turns out, quite recently that an extended family member has gotten themselves into a position where they've been affected by it in pretty material ways. And so I am recently very interested, not just in the crisis as this vague, abstract thing on the horizon, but something that has impacted our family quite personally.
Now, as far as Charleston Southern University, what are you guys doing here to help get the word out, or to help the students who attend here, know that the crisis is going on and some things to look out for?
The thing that we will focus on, among others, is the fact that the opioid crisis can affect anybody. It can affect somebody in a three-piece suit. It can affect a lawyer, a doctor. It can affect anybody. And so when we think about the issue of addiction, this particular crisis is one that is impacting an entire society. And so getting the word out about that, getting the word out about how, for many people, not just those who are affected by the addiction themselves, but also family members, other supporters, there really is a spiritual component. There's a holistic approach to this that I think those of us in the church, those of us in Christian higher education, can really bring an impact to that perhaps other institutions wouldn't or couldn't or simply don't. And so how then do we as a university, how do we as graduates, how do we prepare our graduates to go into their churches, into their workplaces, into their families, and be that change agent? Be the kind of person who can speak to the spiritual, the holistic, the emotional, the relational, all the components of what it means to be a human created in God's image to live for His purposes. And that's what we hope happens here, is how can we do that well? How can we do it with passion and energy? And how can we raise the stakes, raise the awareness across the community, starting right here on campus?
And so now I'll bring up the fact that you are partnering with your alma mater, Liberty University, and the Falwells with that. And what does it mean for that partnership?
Very excited that Liberty University and Dr. and Mrs. Falwell have chosen to partner with us on this occasion. Liberty has been a leader since Dr. Falwell's father's founding of the university in 1971.
And it's very powerful to have the Falwells here on campus as well.
It is.
Yeah.
It is. Yes. Again, I am so excited that the Falwells have chosen Charleston Southern, and in any sort of way we can partner with all the great things that Liberty University is doing. We are excited beyond measure to do that. I think one of us is never going to be as strong as all of us. And so when you have a school like Liberty partnering with a school like Charleston Southern, we really are of the same mindset. Our mission is academic excellence in a Christian environment. Our mission is integrating faith and learning, leading, and serving. And so the opioid crisis speaks to learning, leadership, and service. And so what we'd like to do is make awareness of this crisis larger and larger and larger, so that we can raise the stakes for universities, raise the stakes for churches, raise the stakes for individuals, so that they don't have to wait like I have waited until a family member is affected. So we can be a leader in this area of service.
Are you finding that the students are eager to learn more about it? Are there any that have stepped up and said, I think I may have an issue?
Yeah, I think anytime we offer an opportunity for students to serve, that's the thing about Charleston Southern that is so excited. We attract a type of student who is already interested in serving, whether they come from a Christian background or not. Something about Charleston Southern, because they know that when they come here, they'll be developed into a leader of character whose job is then to go and change the world.
So it is your hope that they'll be able to make a difference on a local level when it comes to awareness?
our students, when they leave this place and go out into their mission field, which is the medical field, we want them to be schooled in so many ways as to the crisis and how they can impact not just medically but also holistically and spiritually and emotionally, all the things that we as Christians believe are significant in a crisis like this. It is an epidemic. And so how then do we as a society, how do we as a Christian university step into that gap to make a difference?
Well, that was President Costin. He was trying to be here, but he's overseas. And if you didn't catch that, he went to Liberty University. That's fantastic. Do you understand that? That's great. And again, we have Becky and Jerry Falwell, who'll be coming up in just a minute. I'd like to transition to Caitlyn Kratz. She's running the Opioid treatment center at Charleston. Yeah, that's right. And also, we have Mike Corvino. He teaches pharmacology here at Charleston Southern University. I want to start with you, Mike, because I think we always have a pharmacologist on set on these opioids, and it's really intriguing to me. Tell us what's going on with the strength of the opioids. We never heard of massive opioid deaths 10 years ago. In the last 4 or 5 years, the spike has been unbelievable. 28,000 directly associated with fentanyl. What's happening?
So I think that's it right there. Fentanyl is such a potent opioid that since its creation, it's been kind of at the forefront of this problem. It's stronger than 100 times stronger than morphine and things like that.
Let's stop for a second. 100 times stronger than morphine, which doctors typically give you as you're coming out of major surgery to combat pain. Why do we need such a strong opioid?
There may be instances such as cancer pain, things like that, it may be appropriate, but
Mike, we've had cancer since the beginning of the country, but all of a sudden we need something 100 times stronger than morphine.
And that's the problem, is its necessity is the issue of debate, because do we really need to? In other countries, especially with certain acute surgeries, they don't use anywhere near the kind of opioids that we do in the pain control.
We use 90% of the world's opioids in America alone. 90% of the world's opioids. Is it time to and I'm going to get a lot of heat for this, because every time we do this topic, we have people who say, hey, I need opioids. Do people really need fentanyl?
And the problem is the data doesn't really back that up, because anytime they study opioids versus something like an NSAID, like ibuprofen or naproxen, or against Tylenol, especially the long-term studies don't really seem to be correlated with more positive outcomes when they use an opioid and better pain control.
Let me go to Caitlyn. Caitlyn, oddly enough, there are dealers out there who have killed people, and they become the most popular dealers on the street because they have the strongest stuff. What's going on? What are you seeing in these treatment centers?
Well, fentanyl right now is the #1 overdose killer that we're seeing. Either folks are having it laced in heroin and not knowing, or there are folks that seek it because it is so potent and the high is so acute. So the average patient we see at the Charleston Center has had an exposure to fentanyl, which is different from even about 4 years ago.
Can you get addicted to fentanyl?
Yes.
Is there any way back once you're addicted to a drug that strong?
Absolutely. Recovery and treatment are great options. At the Charleston Center, I oversee our medication-assisted treatment. It's best practice and evidence-based therapy using the 3 FDA-approved medications, methadone, Suboxone, and naltrexone, to treat an opiate use disorder.
But methadone itself is addictive as well, no?
Well, there's actually a debate about that. It's not so much addictive as it is physically dependent. Coupled with psychotherapy, groups, life skills, folks can maintain recovery, and then the hope is that they can live a life that is substance-free.
All right, let me bring this back to you, Mike. I prepped you with this a little bit. Kratom or Kratom, it's supposed to be an herbal opioid. People say this might be the answer to fentanyl and other opioids. Your thoughts?
The problem is we don't have enough research to really show that. That we have case reports and things where we've seen patients that have overdosed using Kratom, and the big question is, because these are case studies, was it laced with something like fentanyl or a benzodiazepine or something like that, or was it just the pure drug itself, the pure herb itself? We need peer-reviewed, randomized controlled trials to actually show its efficacy. And there's lots of studies now showing that the withdrawal can be just as severe, if not more severe, than opioids itself.
Caitlyn, are you seeing Kratom or Kratom, whatever, you don't even know how to pronounce it. Are you seeing that show up in treatment centers?
We are. Some folks are actually using it to help them kind of wean off of opioids, but we haven't seen that be successful for the same thing, that they're experiencing the same withdrawal symptoms as an opioid from Kratom.
And the thing is, this is a drug that's not a scheduled drug yet. It's not a controlled substance yet. Literally, if you live in an area that has legalized marijuana, most of these places, dispensaries, are selling Kratom as well. Trouble?
Absolutely, and all the online resources in order to order it too. You don't know what that's being made of. It's not FDA approved, so you have no idea what's being added to that or what kind of non-active ingredients are being added.
All right, let me ask you guys this: is marijuana a gateway drug to higher uses, including opioids? Your thoughts?
Yes. The assessments I do on my patients, their first use of any mood-altering substance was about 12, and they transition up from there. So I do believe that there's a correlation.
What is the transition? What's the process?
Well, we usually see teenagers will start with marijuana, then alcohol, and then, if they have the genetic predisposition or, social society factors, that they'll move on to stronger things
like benzo,
prescription pills. Most teenagers will report their first use of an opioid was going into their parents' medicine cabinet or a friend's parents' medicine cabinet.
Right. And your thoughts? Is marijuana definitely or not a gateway drug?
I would tend to agree with that it probably is for a lot of people. There's always going to be cases where it's not for some individuals. Like Caitlyn was saying, there's very different personalities, there's genetic predispositions, there's all these socioeconomic factors that could potentially play in. But to say that it has no correlation whatsoever with future opioid use, I think is a little bit naive.
So what is there an answer? Is there a drug? Is there something that's in experimental phases that could be a less addictive methadone? Does anyone have any? Are there any answers? Are we three people here on the stage that we go around the country and go, well, we just need to reduce the stigma? Yes, we do. But is there anything medicinally that we can turn to?
I think it comes down to the actual prescribing of opioids in the first place. Do we even need that level of pain control? Other countries have gotten by just fine without that. So I think whether or not it's, there's something else to take its place, I think we really just got to get better control of how providers are running
I'm going to have to agree with you. Very quickly, last thought, Caitlyn.
I'd have to say we do have medications out there. We have 3 FDA-approved medications that are best practice and have shown to decrease mortality. So it is out there, coupled with the treatment that we have available. So I think we need to explore what we know.
I'm going to agree with you. Maybe some education, I think. Look, a neck surgery and a lower back surgery was offered opioids, walked away from every single one of them. I'm just trying to figure out why all of a sudden we need something 100 times stronger than morphine. All right, listen, here are the phone numbers. You know someone that's in trouble. You know someone that needs help. You will not be in trouble or get in trouble. You will not be called. Here are the numbers. We're going to put it up on the screen. Make the phone call. Better be safe than sorry. I know all about that. When we come back, Becky and Jerry Falwell will join me on stage. We're going to talk about what they're doing and also questions from Twitter, from Facebook, from you people in the audience and you people at home watching right now. We'll be right back.
It's the longest I've been clean.
To get here.
No cravings, no urges.
Jessica Brock sits in her doctor's office at the VA hospital, 8 months clean after 10 years battling drug addiction.
I was using opiates at first. I went down a road of using crystal meth, snorting heroin, snorting pills.
Brock spent almost 3 years in the Air Force. Both her parents also served in the military, and now her addiction has cost this veteran part of her own family.
When things progressed with my son, things progressed with my drug use. Everything was occupied around getting more drugs, and it just increased.
She lost custody of her now 9-year-old son after a fight, but she says one incident before all of it pushed her over the edge.
While I was in the military, which was more than 10 years ago, I was raped by another active duty member. So I was self-medicating, I was self-sabotaging, it was just, everything just was really getting out of control.
There's an opioid epidemic in our country, and certainly veterans are not immune.
Karen Hartwell helps lead the VA's opioid therapy program. She says it kept the VA's hallways busy. Their clinic served 1,800 veterans in 2018 alone.
We treat the depression, the PTSD, the other substance use disorders that often travel with opioid use disorders. So we really offer comprehensive treatment, and we want veterans to come in and take advantage of it.
Jessica Brock did just that, fighting the enemy within her own addiction and walking away, she hopes, for the last time.
Through the program and everything, I actually feel like I have a future. All that just gives me hope.
Promised we have Jerry and Becky Falwell, two great friends of mine. Very quickly, I'll tell you the story how we got involved in this. I was walking through Trump Hotel in Washington, D.C., and Becky came up to me. She said, "Oh, we would love for you to come speak at Liberty University." I said, "I would absolutely adore that." She said, "My husband, Jerry Falwell's right back there." He came up, and I said, "I would love to speak. I would like to speak about opioids." And he said, "I'll tell you what, we will do a massive event." And I said, "Let's do it one better, and let's get the First Lady out there." And guess what happened, you guys? The First Lady of the United States of America joined me on stage at the beautiful Liberty University, and we put out a show that millions of people saw. And the Falwells have been just fantastic supporting this project. Jerry Falwell, Becky Falwell. Becky, let's start with you. You have a story to tell.
Yeah, today one of my hairstylists was telling me a story about, let me tell you, there was a 26-year-old girl. She was pregnant, getting ready to have a baby. She went into labor. 12 hours before she went into labor, she shot up with heroin. She was hooked to heroin, opioids, and hooked on heroin, opioids, and cocaine. She gave birth to the baby. The baby was born, and it took a while for the doctors. They didn't know about her overdoses and her abuse, and they didn't know about it. So the doctors, you know, during tending to the baby, they realized that this child was hooked on a whole slew of drugs. So they started giving the baby methadone, which is what you do with babies, and you help wean them off the drugs. The mother took the baby home, and the mother had run out of money for drugs. She started taking the baby's methadone just to get some kind of high or something, locked the baby up in a closet for 3 days. And this is all about her addiction. She gave her a bottle every now and then, and finally the police and drug authorities found the baby. 12 days later, she was adopted by a family, and now they're raising her. She's a 2-year-old child and has hope.
And allow me to just jump in there, because that's the First Lady's, that is the reason why she wanted to get involved, to let people realize that this is one of the fallouts of opioid addiction, innocent babies. Jerry, tell us about what you're seeing. What have you seen since we've gotten involved in this, and what are people telling you?
Well, Liberty University has always stocked up on Narcan, so we have it available if it's ever needed. We have always provided positive alternatives for students for recreation, but since I was with you, I've learned that twice as many men than women died of opioid addiction or overdose in 2017. And I think it's a failure by our politicians on both sides of the aisle over the last 30 years. First, they passed bad trade deals that sent all the jobs away. Then they failed to protect the border, and that's where the most dangerous and the cheapest drugs come across. And as you just talked about how dangerous fentanyl is. Imagine if a terrorist put that in the water supply or in the food chain or I mean, it's just scary that we're not protecting our own borders. And that we are.
Jerry, let me ask you both this, and you point out that you have a Narcan supply, which I think is phenomenal. A good friend of ours, David Siegel, is making a push for Narcan, and I believe every classroom, every squad car, every police, every fire department across the country. Are we? And I'm not leading you into an opinion that I have, but some would say by allowing an addict to be pulled out of an overdose with Narcan is supporting bad behavior.
It's saving a life, and I think the president of Charleston Southern just talked about the obligation of Christian universities to help people out. We've always believed that Christianity is about forgiveness. I'm not a pastor. Everybody thinks I am because my dad's name is the same as mine. But I remember he preached that, and he taught his people in his church that there's nothing that any of his children could ever do, no matter how bad it was, that would ever make him love or support them any less than he did the day they were born. So that's what we grew up believing. That's what he taught his church. And that's what we at Liberty University try to do. We try to help people up. And if somebody has that stigma in their past, they were formerly an addict, I think it's our job to give them a second chance, a third chance, a fourth chance. Otherwise, the worst addiction it happens to be in states where the politicians have failed, the jobs have left, there's just no hope. And the reason it's twice as many men as women, we have to get rid of men's sports at Liberty University because the number of women outnumber the men, because the men they don't feel needed. We've created a system where the jobs are gone, the government takes care of the women and children. So the guys are staying home playing video games in their basement.
Allow me, Becky, if I may. The stigma is a problem. Very quickly, your thoughts on what we need to do to lift the opioid stigma across the country.
It's a medical condition, and most of the people get involved in it because of medicine, because they got hurt, they had surgery. It was prescribed by a doctor first, so it's nothing to be embarrassed about, or it's nothing for parents to think, oh my goodness, look what happened to my kid.
If they present themselves with a problem at Liberty,
forgive them.
They're not going to get thrown off
No,
campus.
they are not.
Okay.
And as a parent,
I spoke to Governor Ralph Northam today. I've never met him before, but he told me, I'm sorry to interrupt you, but he told me that he was at Liberty Medical School three months ago, and he was talking about how doctors need to change their habits. I didn't even know, I was out of town, didn't know he was there, and I surprised him. I said, Governor Northam, I want to let you know I admire you. Even though I don't agree with you on hardly any issue, I admire you for not quitting, because if we end up in a society where the media digs up something from somebody's past and then they resign, we're going to have anarchy. So that's another lesson, side subject, but you go ahead.
Well, let me do this, if you don't mind. Will you stay with us?
Yes, definitely.
We want to ask questions from people in the audience, people on Twitter, people on Facebook. Who do you have there?
Yes, Eric, this is Kathleen. Her daughter Isabella passed away back in 2017. She's brought some pictures to share with us tonight. Why was it important for you to come here and share your story?
It was important for me because my daughter was the All-American girl. She was a Wando cheerleader. She had her associate's degree. She loved life. She loved everybody. She had a heart of gold. She was given fentanyl, and she passed away in July of 2017. When she had her wisdom teeth removed in 2014, she was prescribed OxyContin. I didn't know at the time, but my daughter became addicted. The last year, we struggled to get help in Charleston. I hit every brick wall you can imagine. There was no place for us to go. We were fighting a battle alone. And she came home from rehab. I had to take her out of state. She came home, she was doing great. But the drug dealers, they come after them. They're like leeches, they don't stop. And my daughter got sucked back into that same world, and I want justice.
I'll tell you what I'll do. You come up here. Will you get another question, maybe from John? Or John, please step up and ask a question. Will you come up on stage with me? Just come up. Just come over here. And while she does that, go ahead. Another question?
Yes, Kevin. We have Kevin here. He goes to Coastal Carolina University, and he has a question, too, for one of our experts.
Yeah, Eric, traveling the country, being a student, what is the most effective thing someone watching on TV at home can do immediately to help combat this epidemic?
Clearly, come on up, but just join us. Clearly, the most effective thing that people who are watching right now can do is to remove the stigma. I've said stigma 100 times tonight. I think that's the most important thing I've learned. I've learned a few things about what happened with my son. I've learned things with parents who maybe look the other way. But we all need, every single human being here, every person watching right now can stop making opioids a stigma. It's no longer someone has a line of heroin in their vein in an alley somewhere, or a junk. It's now become people trying it for the first time, people getting hurt, people having a toothache and end up opioid addicted. And now some of this stuff, as our pharmacologist told us, 100 times stronger than morphine, is killing people. Have the discussion. You're not going to go to jail. You're not going to get thrown out of school. You're not going to get thrown out of your house. Please, parents, don't throw your kids out of their house for this. Get them some help. That's the best answer I can give you. Good?
Thank you.
John.
Hi, John.
Hi. Yeah, I was wondering about the drug manufacturers themselves. I mean, what can be done to hold them accountable to stop over-manufacturing and producing these dangerous drugs? Because it just seems they're producing. There's no checks and balances.
Such a great question, and this is one of the questions we have. It's a free market, right? They should be allowed to produce. But what we found, John, and Jerry and Becky, what we found was Purdue Pharmaceutical, for example, who produces OxyContin, an opioid. Purdue Pharmaceutical was producing so many, they were incentivizing their sales force to talk to doctors to give them more OxyContin to prescribe. What are they going to do? They're going to prescribe them. They were giving doctors golf junkets to go ahead and sell more OxyContin. You're right. We need to create the awareness. Look, I'm a libertarian. I don't believe we should have laws that limit anything. I think we have to create awareness by doing what we're doing. WCIV here, talking in Charleston, around the country. Have the discussion. Tell your doctor not to prescribe unneeded opioids to your children. That's the first way. That's the first level of what we need to do. Anyone disagree? Jerry, anything you could add to that? Becky?
All right. Go ahead.
What I was thinking of, and this is completely weird, but of the Lion King, and there's a circle of life. And in the circle of life, the parents are supposed to pass away first, not the children. And it's just unnatural, and everyone has always said it's the most unimaginable and worst thing you could go through was your child to pass away before you. And you know, and she knows, that that's the truth. And it's just not, it's not natural, and it's just a sad thing to happen.
Let me jump in with one more question. You have one more?
This one coming up from social media on Twitter. Andrew asks, what's the opposition to introducing medical marijuana so we can have an option that's not habit forming on the same level as opioids?
So, Andrew, we had two experts up here, a pharmacologist and a treatment center expert, saying that they both believe that marijuana could be, am I paraphrasing right? Marijuana could be a gateway drug. They're saying yes. So I don't know. I'm, again, libertarian who believes that you shouldn't be told what to do.
But in states where they've legalized it, there's a black market already.
Yeah.
They're not going through the white market. They're going through the black market. And so I don't know if legalizing helps anything.
I don't know if it does either. That's a $64,000 question. I don't know. Your daughter's name was? Isabella. Can we get this? We got it. We got it here. All right, I'm going to say this. This is the end of the show, and I wanted to, first of all, I want to thank everyone clearly. Before we go, though, we had NASCAR. We had Rick Ware Racing, who were going to be here. They have opioid messaging on their car. They have 2 cars traveling around an oval every weekend with an opioid message saying, race to erase opioids. There's a website to go there. They couldn't be here because we're going to show a couple of pictures. Those 2 race cars crashed this weekend at the Daytona 500. Coincidentally, they crashed into each other. That's another story, but we'll have that for another day as well. But I also want to thank everyone who were here, everyone who came by. I want to thank WCIV Television. Thank you so much for our WCIV anchors as well. They've been fantastic. St. Clair Broadcast, been terrific. Charleston Southern University, fantastic. The Falwells, Liberty University, thank you. And to the students who watch and who get involved. Very quickly, parting thoughts. To parents, not my kid syndrome is deadly. Everyone thinks that their kid is too smart, too athletic, too happy, too sad, too white, too black, too Muslim, too rich, too poor. Guess what? Not true. Everyone will cross everyone's path. And the kids, one pill can kill. My beloved Eric Chase, sophomore, bought a pill on campus. He thought it was legitimate. He thought it was a Xanax. It was laced with fentanyl. He put it in his mouth. He never woke up again. We're going to leave it right there. We're going to say thank you to everyone for joining us. Again, we're around the country. Thank you, Sinclair Broadcast. Thank you, local news anchors. And thank you all for coming out. Appreciate your time. God bless everyone. Good night, everybody.
Has been brought to you by Liberty University.
Channel 1, Channel 2.